Okay, Psych 250, we were talking about Chapter 5 and specifically the case study of the sensitive dentist. This dentist really did his homework to anticipate the potential reaction of people misinterpreting his cultural background and thinking that they were the enemy that they had fought in the war. And try to diffuse the situation before it escalated. People are already anxious as it is to go see a dentist and perhaps experience some pain, but to see the pain administered and perhaps even having a flashback, that's just a recipe for trouble. Now, what else can the rest of us do to try to ease ourselves down from such traumatic responses? Well, there are medications that people can take. And I know the reason that people say right away, oh, I don't want to get on medication because I'll get hooked on it and then I'll become Michael Jackson or Prince or Elvis, those types of things. The idea behind medication is just like any medication, right? It's to treat the symptoms, but you're also doing other things to reduce the malady. So, is it possible for some people to get hooked on medications? Of course it is, right? We've seen case after case of that. But the chances are, if you're under a doctor's care, that that's not going to be the goal. As a matter of fact, the goal is to get you off the medications eventually. So rest your fears, have some concerns, talk to your doctor about it. And usually we're talking about a psychiatrist who's going to prescribe these medications. Now, there's other forms of treatment. For example, as I mentioned earlier, being exposed to the trauma itself, having some cognitive behavioral techniques used. With the cognitive behavioral techniques, they're getting you to think about what's going on, right? The whole process. And then to work on some behavioral techniques to calm yourself down. Maybe some breathing exercises, maybe some yoga. Some of you just like to lay in a body of water and float like a starfish, right? Just again, what I mentioned earlier, slowing down, just taking a moment, being mindful of yourself. Now, one technique that I'm in favor of is systematic desensitization. And here's a technique that's geared right towards the visit to the dentist, right? So the idea with systematic desensitization is that you're going to approach the issue step by step, slowly getting you closer to the fear stimulus, but starting off in a very mild way and offering a lot of positive reinforcement. This is obviously a behavioral technique. Anytime you hear reinforcement, that's the first thing that comes to mind. So the first thing is you just, first step is just you drive past a dentist's office on a Sunday afternoon. That's at the bottom here. The dentist isn't even open, and there's no way that you're going to be subject to any pain or anything. You're just driving by. And then you drive by on a day that it is open, but you're not stopping, you're not making an appointment. So the idea is, if you look at these carefully, you get closer and closer, step by step, to actually making the appointment, going into the office, and then experiencing what you need to experience. Now, this technique is very effective for treating phobias, we mentioned earlier in another chapter, and certainly is very highly effective in treating anxieties. If you have somebody who helps you with this technique, have them do it step by step, give you lots of positive reinforcement. You're in charge, so you never move forward until you're ready. And it's extremely effective. Now, the person who's helping you with the process has to be patient. They can't rush you. If they try to rush you, you're going to be overwhelmed and you might regress. I mentioned before that stress is tied to our body, right, which can produce all kinds of psychophysiological reactions. And we typically know when we're stressed is when we start having all kinds of ailments, right? Our sinuses start to act up. We start getting rashes. We can't sleep at night, right? So we use CBT, cognitive behavioral treatment. We use eye movement desensitization. And I remember when this first came out in the early 1980s, I believe it was, or late 1980s, I just thought, how crazy is that? Just moving your eyes back and forth to help people relax. Well, biochemically, something's going on. And you're also, again, stopping to smell the churros. You're taking the time just to focus on one activity. Anytime you stop and just let go of things, that could be somewhat productive. And for those who've practiced yoga or meditation, you know exactly what I'm talking about. Some of you have practiced meditation, don't even think that you've practiced meditation, but you just sat in your most comfortable chair or laid in bed and listened to that music that was soothing, and you just went somewhere else, right? Can stress damage you? Actually, it can. You know, you've heard of somebody having a broken heart, right? Being traumatized with a breakup in a relationship. There's evidence that shows that they actually do have heart damage. So, you know, that broken heart thing is not so far from the truth. So, this stuff is real. The fact that stress can kill you, it's just like that conversation you had with somebody um, at the bus stop and their age happened to come up, right? And suppose you're talking with me and it says, yeah, I'm 21 years old. And you look at me as like, oh my God. And you find out I lived a very hard life. It takes its toll and it can produce dire consequences. Why? Because it can affect the heart and the functions of the heart. And the heart is where it's all at as far as keeping our body going, right? Besides the brain. And it can lead to all kinds of contributing factors, right? If I get stressed, I turn right away to my potato chips because that's my comfort food. You know, it's not going to be the most ideal, healthy food for my fuel to deal with the rest of my issues. And a lot of us have known to do that. The stress can also lead to things like hypertension. Hypertension or high blood pressure is a killer, right? Not only produce strokes, but actually literally kill people. And many of us and our families have individuals who suffer from hypertension, right? So we got to monitor that stuff. We got to just chill out, so to speak, right? And some of that's tied to our diet, some of it's tied to our culture, right? But when we've got all these problems zeroing in on us and which produce stress, you can see their end results. Headaches. Oh my gosh, you're probably getting a headache just watching this video talking about headaches. They can be so debilitating, like migraines, that they can just keep you in bed. You can't even function. Now, other people think, well, just take an aspirin, you'll be fine, right? But if you've ever had a migraine headache, you know that's not just aspirin. That migraine headache is going to eat that aspirin up and say, "Is that it? Is that all you got?" Right? Cluster headaches can be so debilitating too. They're like stabbing pains in the eyes. You know, you think of your worst horror films, somebody stabbing somebody in the eye. That's what it feels like. It's just horrible. Do you know that little kids can suffer from maladies? You know, oh, Johnny's having more asthma attacks. Well, Johnny's stressed. Why? Why is Johnny stressed? Well, because he overheard mom and dad talking about getting a divorce. And so his asthma attacks have increased. And guess what? Johnny's in an environment near a busy street or freeway that's polluted, right? Lots of pollutants in the air. That's contributing factor. So we have to pay attention to these sociocultural issues, our own behavior issues that can contribute to our own stress. Now, it'd be all wonderful if we had all this free time just to exercise and eat healthy foods from our own personal farm, right? We don't have the luxuries of doing that, but we do have some choices, right? And our choices is to support the immune system, right? One of the things I hear all the time is many people are immune compromised. In other words, they have some illness that's already affecting the immune system. And the world has changed drastically. The foods that we consume, the amount of pollutants in the air, the use of different chemicals we do to even treat weeds and so forth, these are all contributing factors. So we have to be cognizant of those and try to eliminate those as much as possible. Mind is a terrible thing to waste, right? So it's brain power. And the more information we have, the better practices we can utilize to take good care of ourselves. There's only so many things we can do to control our social dimensions. But what's amazing is we get older and more independent, we get to control who we're around, right? Um, you have social media, you have people who like you have people that get you stressed out. You push a button and say, you know what? I'm not going to have much to do with those people who are stressing me out. Life is too short. I'm going to embrace people who want to share some positive things with me and write back at them, right? And life is short, believe me. Women are more subject to more stress than men and different types of stress. It's not that men are not stressed because they have different sets of stress, but we have different expectations of what the role of women should be. These are part of the social, cultural, uh, and gender issues. So, what can we do? We've talked about stress enough. What can we do? I can't stress enough. You've got to take during the day and to relax, right? Now, I know some type A people who are just very competitive and hard driven. They don't want to sit and do nothing because they feel like they should be doing something all the time. But it's absolutely important that we listen to our bodies, biofeedback, and we stop and smell the churros. Most of us are in such a hurry, with wearing the shades like the horses who are just going from point A to point B. We don't even notice that there's churros or roses or whatever that might capture our attention. We live in such a beautiful community, and we don't take the time to appreciate it. So don't just think about it, do something about it. That's what the cognitive behavioral perspective is all about. Take action, build it into your schedule. One of the things I do on a daily basis, because I'm dealing with diabetes, or as I like to say, I'm a sugar daddy, but people misinterpret that when I say that. So I have to quickly tell them I'm type 2 diabetic, is I take the time to do my walkabout. I do a little bit in the morning, I do some in the evening. I try to do it either walk the dog in the morning or walk with my wife in the evening, but I try to make my 30 minutes brisk walking. So, and I keep track of that. I keep track of it on my phone. So if I don't get my 30 minutes, I'm going to do a little extra tomorrow. If I got a little over and I don't feel as much to do as 30 today, I can tap into my walking bank, so to speak. But on average, it's at least 30 minutes a day, and it's made a difference in my relaxation level. It's something I look forward to now because of all the problems I have. I know that I can just let my mind go. I can listen to music or converse or listen to a podcast and just get lost in my own little world. Now, you've been patient, so I'm going to reward you with a couple essay questions from this chapter. The first one, of course, excuse me, is the sensitive dentist. Tell me everything you remember about him, as well as the disorder. Excuse me. Second question deals with talking in depth about the cognitive versus behavioral and sociocultural stressors. What are some of the contributing factors that play into our mind, our behavior, and our sociocultural variables? And those are all connected to one another. You can't really separate those two things, but I want you to go into depth as to what those schools might have to say about it and what's our reality in our own environment. Feel free to use your own examples. Examples are always valuable because you know what you're talking about, right? I appreciate your attention. Looking forward to the next chapter.